Welcome back with another video. In this video, we will discuss how to assess and diagnose diabetes. So let's get started. Assessment of diabetes mellitus. First of all, we should look at the risk factors like overweight or obesity, physical inactivity, diabetes in first degree relatives, history of gestational diabetes, cardiovascular diseases and its risk factors, and ethnicity, which includes mostly South Asian, Afro-Caribbean and Hispanic ethnicities. Assessment of signs and symptoms for diabetes mellitus. Look for polyuria, excessive passing of urine, polydipsia, excessive thirst, polyphagia, meaning excessive hunger, unexplained weight loss, vision changes, fatigue, signs of acute metabolic deterioration, signs of chronic complications. Majority of the cases have no clinical symptoms and can present with complications directly. Home to test. Test adults who are symptomatic or aged greater than 40 years or who are overweight, meaning having BMI greater than 25, or obese, having BMI greater than 30, or follow national guidelines. In asymptomatic people, it is recommended to repeat testing to confirm the diagnosis, preferably with the same test as soon as practicable on a subsequent day. Diagnostic test. Venous plasma glucose is the standard method for measuring and reporting. However, in the recognition of widespread use of capillary sampling, especially in low resource settings, values for capillary plasma glucose are provided for post-load glucose values. Fasting values for venous and capillary plasma glucose are identical. Glucose should be measured immediately after collection. Otherwise, the blood sample should be collected into a container with a glycolytic inhibitor, immediately centrifuged to separate the plasma, and frozen until analysis. Diagnostic criteria for diabetes mellitus. If the fasting venous or capillary plasma glucose level is greater than 7 millimole per liter, 2-hour post-load venous plasma glucose levels greater than 11 millimole per liter, the 2-hour post-load capillary plasma glucose level greater than 12 millimole per liter, the random plasma glucose levels greater than 11 millimole per liter, or the HbA1c equal to or greater than 6.5%. If the patient blood glucose level tests meet any of the above criteria, then the patient will be labeled as diabetic. Important advice. A person is diagnosed with diabetes if the fasting plasma glucose is greater than or equal to 7 millimole per liter or 126 milligrams per deciliter. The people who have been diagnosed with the diabetes, they should eat a healthy balanced diet. All the patients should practice regular daily physical activity. If the plasma glucose is not controlled with lifestyle changes, pharmacological treatment must be initiated. All the patients should be advised on avoidance of tobacco use and harmful use of alcohol because both of these may exacerbate the condition. So the points discussed in this slide regarding the management will be discussed in the next video in details for better understanding. Thanks for watching this video. Hit the like button, share and subscribe. See you in the next videos.